everyone for coming out. We're going to do the migraine talk now. This is going to be about the migraines, and we're about to welcome a state board certified neurologist in Dallas with Neurological Associates in North Texas, Dr. Sharisse Stephenson.
Thank you. My name is Dr. Sharisse Stephenson. I'm a neurologist right here in Dallas. I've had my own practice for close to 10 years now. And I'm a board certified headache specialist and brain injury specialist. So migraines are my thing. I personally suffer from migraines, and I can tell you that migraines are not just a headache. It can be far more than that. So migraine is a very common disorder, and what people don't realize is it can be very disabling to people who suffer from migraines. And the burden of migraine is greatest for people who have severe migraines, not only for the people, but for their families, their inability to go to work, their inability to go to their kids' baseball game. And oftentimes, people will say they just have a headache. It's just a sinus headache. It's just a tension headache. But the majority of the time, it really is migraines. If it's a headache that makes you want to take a pill, that makes you want to lie down, that makes you not feel like doing something, then it's probably a migraine. So migraines are underdiagnosed, and often patients, unless they have very severe symptoms, won't seek treatment. And we have so many great treatment options now that people really don't have to suffer and miss time in their life due to migraines. So right now, there are currently 36 million people with migraines over the age of 12, 27 million female and 9 million male. Nearly 1 in 4 households has at least one person with migraine. Anyone here suffers with headaches?
Yes, right here.
So, see, just here in this room, we can see how many hands have raised for people who suffer from headaches. So a very, very common problem. Migraine, when you look at these numbers, is more common than osteoarthritis, diabetes, asthma, epilepsy. But we don't tend to talk as much as we should about it. Other common headache disorders are tension headache and just having a chronic daily headache. So migraines by far affect women more so than men, but men still also can suffer from migraines. Migraines cost a lot of money, not only just to the individual, but to their family and to society. So the cost for emergency department visits, urgent care visits, buying autos and leave, and extended migraine, the cost of missing work, the cost of not being able to do what you need to do because of migraine. It actually takes a financial toll on them. So migraines are episodic attacks, so episodes of head pain, and usually you have other symptoms like light bothering you, noise bothering you, sound bothering you, not wanting to move, nausea, vomiting, dizziness, not feeling like being clear. These are all symptoms that can go along with migraine, so it's really not just a headache. There's definitely a genetic component to migraines. And people that have migraines, our brains and nervous system just don't act the way that they really should. We have more sensitive brains. And this is a picture that shows everything that's going on in a migraine. So you have your brain, then you have the nerves, you have your blood vessels, then you get inflammation, and you have all these moving pieces that work together to provoke a migraine attack. So we call migraine a neurovascular pain syndrome. So what we're talking about is that there's definitely a blood vessel involvement, but there's also a nervous system involvement with the nerves and the brain. The one thing that all doctors should do if a patient is coming to them with headaches, not just neurologists, not just headache specialists, is we need to try to figure out if a headache is in these 2 big categories, primary versus secondary. So primary means you can be hurting, the headache can bother you, it can be disabling, but there's not an underlying bad cause like a stroke or a brain tumor, or meningitis, or a hemorrhage. That's the actual cause of the headache. So even though it can be disabling and feel bad, there's not a secondary issue that we need to be treating, such as stroke, tumor, and so forth. So that's the big category. That's the big category we really have to pay attention to, because we don't want to miss the stroke, we don't want to miss the meningitis, we don't want to miss the tumor. So there's some red flags that can be involved with headache. The little mnemonic that we use when I went to medical school and in residency is called SNOOP. So if you have systemic symptoms like fevers, weight loss, if you have new neurological symptoms like weakness, numbness, if it's a new sudden onset headache you never had one before, if you're an older person over the age of 50 and never had headaches and all of a sudden you start having headaches, then there could be something else going on. Or if the headache is different than your usual headaches. If you have any of those symptoms, then definitely need to get evaluation ASAP. So migraines are really underdiagnosed. People will say that they have sinus headaches and tension headaches, but oftentimes it really is migraine. And you treat each of those disorders differently. Some patients wonder, do I need to have an MRI of my brain? Not everyone that has a headache needs to get an MRI of your brain. It's only if there's red flags, like you're having new neurological symptoms, and you've never had headaches, and you're just having a new sudden headache disorder. So you really don't want to waste your time and money getting an MRI. If there's nothing suspicious, then it's clear that it's just a migraine that we just need to treat appropriately. So for migraine treatment, you think about if you have a lot of headaches, we need to try to prevent all of those headaches. But then when you have a headache, you need to have something that you can take that works and ideally does not cause side effects. So there's lots of different medicines. Probably a lot of people will take ibuprofen, Tylenol, just over-the-counter medicines. Sometimes we get steroids for a bad headache attack. We really try not to give strong pain medicines like codeine or hydrocodone or morphine, because that can actually make the headache come back. So that can work against us. Then we have new medications like CGRP. So medications that act on this protein called CGRP that's elevated in migraines. And then we have the old medicines like Inotrex and DHE, which acts on the blood vessels that are dilated in migraines. So triptans act on the blood vessels in that nervous system to try to help abort the headache and stop the headache. Inotrex being one that many people have heard of. So you can take it by pill, shot, nasal spray, lots of different forms of it. You can do things like lie down in a quiet room, get good sleep. And then there's preventative agents. So a lot of medicines that we use to prevent headaches are old medicines that we use for other things. So certain antidepressants, certain blood pressure medicines, certain seizure medicines. I do a lot of Botox injections for people that have frequent migraines. For whatever reason, Botox really can help for migraines. And then we need to talk about other preventative options, such as medications that act on this protein called CGRP, calcitonin G-related peptide. So we've known that this protein is elevated in people with migraines. So for years there's been research to try to find ways to attack this protein. So now we have a lot of different options. We have some options such as pills that can block the receptor for the CGRP to help stop the headache attack. But we also have a lot of preventative medication options that are almost fake new antibodies that bind to CGRP so that you don't have to have headaches, to prevent the headaches before they even start. And I'm going to talk about one in particular, Vyepti. So it's an infusion, it's a 30-minute infusion, you only have to get it every 3 months. And you can start feeling good from your headaches as soon as the day afterwards. And up to 22% of people who got this medicine reach headache freedom. And those are numbers that we're not typically used to seeing. And it's super well tolerated, and it's just a new great treatment option. There are definitely other medications in that category as well, cortisone shot every month. So there's for prevention, and there's a new medication that acts on the receptor, the CGRP receptor. So if you have headaches, you do not need to suffer. If you're in Dallas, give me a holler. I'm here. Headaches are my thing. And I love to treat people's headaches, and I love to watch people get better and get back to their lives. So there's no need to suffer. If you have family members that have headaches, let them know. Talk to your doctor about it. You don't have to suffer. Thank you very much.